Welcome back to Cancer Buzz. I'm your host, Summer Johnson. This week, ACCC is hosting its 40th annual National Oncology Conference in Austin, Texas. Multidisciplinary oncology leaders from all across the nation will gather to discuss the latest trends and share creative solutions to pressing challenges in cancer care. This year's theme is Reimagining Innovation. Today, we're previewing some of the topics that will be at NOC. We're speaking with our next guest about biomarkers for Medicaid beneficiaries. Our guest is Kathy Oubre, CEO at the Pontchartrain Canter Center in Covington, Louisiana.
So I think the biggest challenges in getting biomarker testing for our Medicaid patients really is not limited to what kind of setting you're in, whether that's a rural or an urban setting. I think a lot of us have the same challenges. The biggest challenges would be primarily the payer and the timeline that operates within. So it's not just as simple in biomarker testing as being able to pick a study and ordering it. We have to think about the finances behind that for our patients. And then most of these tests we have to get authorized. So if you have a patient that comes into your practice with a fairly aggressive cancer, a lot of times, if you think about the timeline it takes to order the biomarker testing, get the authorization, then, obtain, whether that's a liquid biopsy or the tissue biopsy, send it out, get it read out, and then have that patient come back. Sometimes, you could be looking at, a timeline of 3 weeks or more for those results to come back in. So when you have that highly aggressive cancer, providers are often faced with that dilemma. Do you start the patient on something immediately, but you're not quite sure that it's going to work, but then, it's so that something is better than nothing? Or do you do that wait period in the hopes that it'll come back faster than you think, and then gives you those results for the optimal treatment for that patient?
What strategies have proven to be successful at your center or those that you've witnessed in connecting patients with this testing?
So when we're looking at biomarker testing and matching the right patient to the right biomarker company, it really is a little bit of homework in figuring out what panel do we want to choose that isn't necessarily, throwing the kitchen sink at that diagnosis, but really being kind of judicious in the test that we're choosing and having that quick conversation with that biomarker company around their current costs, around what their financial assistance platform looks like. Because again, they come to our offices and it's that, oh, we will never send a bill to a patient. And I know that everyone strives to do that. But things change for companies, for patients. And so it's always taking the time to call that company and just ensure as best as we can that we are making, the best informed decision for our patients.
What's your best advice for community practices?
Something else that practices need to keep in mind when we're talking about biomarker testing is develop your operational workflow around this, because it involves so many moving parts. Maybe you're obtaining the authorization, maybe the company is. And then, we send this tissue out or the liquid biopsy, and it just goes into this nebulous space. And in the meantime, we're waiting on actionable results. So, send that information off, but keep a log. What we do at our organization is we keep a running log per patient of where everything is, where that biomarker testing is in its timeline. So whether that's being sent out, that they've received it. And once they've received it, then in our minds, that kind of sets another clock. And we know to be contacting that company on a regular cadence, whether that's every 2 business days, every 3 business days, to see where it is in that process of being read. And then once it's read out, how long will it take us to get those results back? So whether you're logging into a portal or whether that's faxed to you or mailed to you, then once it gets into our organization, have your workflows in place. Whether the paper results are given to that provider, whether that it's scanned into your EMR, and if it is it loaded into discrete fields or is it loaded into a PDF? But really have defined workflows within your practice on your key stakeholders, who's having ownership of each segment within that biomarker testing journey. And then once those results come back in, who's taking ownership of that? Who's contacting that patient for that return visit at a very appropriate time and not a week or 2 later, so that patient can come in and the patient and the physician can decide those next steps in their cancer care journey.
Thank you, Kathy. We'll be back tomorrow from Austin with discussions from the pre-conference sessions. Stick with Cancer Buzz right here all this week as we cover the events from the ACCC 40th Annual National Oncology Conference. Until then, I'm Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.